Well, good morning, everyone, and welcome to the Sphere 2017 International Symposium. It's our inaugural symposium, and it's looking at innovation in healthcare, and I'm really delighted that you're all here. It is an exciting and an important event for everyone involved in Sphere, and it's my great privilege to be the chair of this organization, the Sydney Partnership for Health, Education, Research and Enterprise. And we are collectively working in partnership to have a greater impact on the health and well-being of people in New South Wales, in Australia, and worldwide. Before I go any further, I want to echo the words of Uncle Charles Chicka-Madden and acknowledge the Gadigal people, the traditional custodians of this land. I pay my respects to elders past and present, and I extend that respect to other Aboriginal and Torres Strait Islanders who are present today. It really is true that Sphere has a particularly special relationship with the Aboriginal community, and that's reflected in our Indigenous name, Maridula Badjari Gamal. That's a gift from the Darug clan, and in the language of the Darug people, the name means working together for good health and well-being. That describes perfectly what Sphere is about and what this symposium is about. And it also acknowledges our strong commitment to the Aboriginal community and the cultural diversity of our partnership. So we're proud to bear that name. So I welcome you all here today, all of our participants from near and far, our fantastic speakers, and all of our Sphere partners. The inaugural symposium brings together experts from a range of disciplines to share their knowledge and experience within a very creative context, as you'll see as the program unfolds. The program over 2 days reflects Sphere's approach to innovation, to inclusion, to conversation, debate, and importantly, to action. And everyone involved hopes that this will stimulate discussion and perhaps most importantly, action amongst everyone who attends and those that you interact with afterwards. Sphere was formally born just over a year ago, but it followed on a lengthy 18-month gestation from a desire to link hospitals, institutes, universities, primary care providers across public and private funding and across disciplinary boundaries and large geographical distances. That was no small task, and it required an innovative approach, hence Sphere. Sphere is a collaborative partnership. It brings together 14 member organisations from across 3 different sectors: universities, medical research, institutes, health services. It supports more than 2 million people, cared for by more than 50,000 staff. Bringing all of that together is an innovative approach, but it's not new. Academic health science partnerships over more than 30 years have delivered enormous benefits across the world in places like Europe and North America. They'd be relatively late to develop here in Australia. As a surgeon and a medical researcher, I spent much of my career working in, founding and leading academic health science partnerships in London and Manchester. And when I arrived in Australia, the potential that I observed in Sydney to create a really powerful network was extraordinary, but the barriers and obstacles were significant. And it's been an absolute joy over the last 2 years to work with colleagues who have a commitment to working with generosity of partnership, who can see the potential of breaking down the barriers in the health system in New South Wales and are now actively doing that through Sphere. So Sphere's vision is to advance the delivery of healthcare and improve the health and well-being of our communities. It really is true that the benefits, if we can achieve them, are not just in research, they're not just in education, they're not just in clinical care, and they're not just economic. The wonderful thing about an organisation like Sphere is that the benefits are in all of those things. Sphere cares for some of the most culturally diverse and disadvantaged people in Australia. 40% of the catchment area were born overseas, 35% have a primary language other than English. Sphere focuses its work in a geographic arc which stretches from Liverpool to Bowral, across to Coogee and through St George to Sydney CBD. And that reach sees us serve the fastest growing population in Australia, as I said, over 2 million, including many Indigenous people and refugees. Our partner organisations involve over 50,000 staff, over 100,000 students and over $5 billion per annum revenue. And they're committed to improving health outcomes and the translation of medical research into impacts on the health and well-being of our population, and they're putting their money behind this commitment. All 14 partners have contributed to a Sphere seed fund, and that fund is distributing the money to support this ambitious partnership. That's enabled an investment, a seed fund investment of $20 million over 5 years to drive and facilitate change. Given all of that, I'd like to take this opportunity to thank the members of Council, not just for their commitment to Sphere, but for the way they demonstrate the highest quality collegiate working across such a complex organisation. It's a pleasure to work with all of you, many here today, and a pleasure to be sharing this stage with my colleague and counterpart at Western Sydney University, Professor Barney Glover. In a little over 16 months, Sphere's brought together people across a range of disease areas and disciplines, and they've come together in a magnificent way, which really is now, as you'll hear during the meeting, beginning to yield benefits. Many new relationships have been formed, new ideas generated. We have an exciting momentum. And although it's early in the life of Sphere, I'm just going to run through a few of the early successes. After a rigorous accreditation process, Sphere defined 12 academic groups from an amazing array of 27 proposals. The clinical academic groups, or CAGs, comprise over 1,000 members, including patients, families, community representatives, local government and urban planners, and they include, and there are 12 of them, infection, respiratory, diabetes, obesity, metabolic disease, chronic disease in children, neuroscience, Aboriginal health and well-being, genomic medicine, musculoskeletal health, aging, cancer, maternal, newborn and women's health, and early life determinants of health. And those teams, that's not just names, those teams are fully functioning. They have access uniquely in Australia to the $20 million of seed funding, which I mentioned. In May this year, we distributed $2 million to support these projects, and by June, we'll have spent more than $3 million supporting Sphere and related projects, and we're proud of the work they're carrying out. More than that, though, we've secured MRFF funding to support Sphere involvement in 3 national initiatives, with Sphere itself co-leading health services improvement and sustainability and participating in data-driven healthcare and improving Indigenous health. We've secured more than $400,000 over 4 years from New South Wales Ministry of Health OHMR to support clinical trial improvements. We're part of the consortium led by ARCS, funded by MTP Connect to support building capacity through education and training for clinical trial coordinators. We're one of 9 nationally accredited advanced health research and translation centres currently working with the Australian Department of Health to inform next steps with MRFF, and we're working with NHMRC to develop performance reporting for the centres. We're a member of the Association of Academic Centres of Health International, participating in global conversations around things like clinical trials, health service improvement, big data, and many other areas. We're working with New South Wales regional health partners and Sydney health partners, importantly, across the city, and New South Wales MOH, OHMR to develop statewide programs that will include all New South Wales health services, especially those that are not currently members of any of the 3 centres I've mentioned. And we have even more exciting plans for the future. We're collaborating with other leading centres in Asia, Europe and North America. We're recruiting outstanding academics from overseas. We have plans to introduce Sphere Clinical Fellows, a clinical collaborative centre, a future health centre, new training programs, over $1 billion worth of investment in the estate of our organisations, in our health precincts, and over $1.5 billion in recruitment of staff at all grades across our organisations. So Sphere is a long-term venture, but most importantly, it really is about ensuring that nobody in our community gets left behind. And that's going to require a sustained effort and a commitment to staying true to our mission of delivering advances in research, education, clinical care and innovation, which transforms lives. Because ultimately, there is no reason, in fact, it's almost an embarrassment, but there is no reason for Sydney not to be recognised as being in the top 10 biomedical and health centres in the world. We have the expertise, the wealth, the resources here in Australia to make this happen. And Sphere can be a part and play a big role in raising our quality and profile. That's the challenge for this organisation across Sydney and New South Wales. Now, before I finish, I'd like to make a special mention of the organising committee who've put an enormous effort into putting this event together over the last 18 months. Professor Chris Levy, Sphere Director, Professor Bob Clark, Chief Scientist in Residence at UNSW, Professor Les Bouquet, who was the inaugural Sphere Director, Melissa Noth-Tate, Professor of Biomedical Engineering, Professor Michelle Haber, Director of the Children's Cancer Institute, Karen Joyner, COO of Sphere, James Kemp, COO of Translational Health Research Institute at WSU, and also mention Alex Davis and Sue Midgley, curators of the VIA Art Programme, which you will enjoy during this meeting. I just want to give you an opportunity to give them a round of applause for all their efforts. The programme and the symposium they've created is exceptional, and I hope you'll all enjoy all that is on offer. This morning, once you've heard from Barney after me, we'll hear from Innovation and Science Australia, and I'm delighted that Charlie Day is here to give that talk. Innovation and Science Australia are the group responsible for providing strategic advice to the government on all science, research and innovation matters, and I'm looking forward to hearing what Charlie has to say. We'll cover topics from innovation in healthcare to personalised medicine and how the built environment impacts on our health. You'll hear from Lucy Turnbull from the Greater Sydney Commission, and we'll cover the all-important topic of public and patient involvement in healthcare delivery and research, and we'll be treated to art installations and performances, please don't miss them, to add a multi-sensory and interactive edge to the issues we're exploring. So once again, I welcome you all here. Thank you for coming. I hope that the next 2 days are rewarding for each of you personally, that they produce some great ideas that we can then all apply to improve and transform our healthcare system, and most importantly, to transform people's lives. Thank you very much.